Respiratory muscle training for flaccid dysarthria and dysphonia in geriatric myasthenia gravis through telemedicine during the COVID-19 pandemic. Because of the widespread expansion of telemedicine that has occurred as a result of the COVID-19 pandemic, our research focuses on the potential benefits of teletherapy for geriatric patients who have complex neurogenic communication disorders. Our lovely participant in this study was Mr. Roberts, a 65-year-old pastor from Springfield, Missouri, who has a recent diagnosis of myasthenia gravis comorbid with the early stages of Alzheimer's disease, and he lives with his wife, Charlotte Roberts, who is his primary caregiver. So throughout the summer, Mr. Roberts attended therapy twice each week with us on Zoom, and in each of the sessions, he completed respiratory muscle training exercises using the breather, which is a device from the company PN Medical. It's often used with patients who have myasthenia gravis, and it targets their respiratory weakness. So he also completed exercises using this device at home with his wife, Charlotte. The breather is intended to strengthen the inspiratory and the expiratory muscles by adding resistance as the client takes breaths. And you can do this by adjusting the settings on the device. On one side, there's inhalation with numbers 1 through 6, and the lowest amount of resistance would be a 1, and the highest would be a 6. And the other side is exhalation, numbered 1 through 5. And again, you can adjust this with 1 being the lowest and 5 being the highest. And you can increase this resistance over time in therapy. During respiratory muscle training, Mr. Roberts used the breather to do sets of 5 breaths. And his tolerance to the added resistance throughout teletherapy was measured by his maximum expiratory pressure, which was measured in centimeters H2O, using a manometer that was attached to the breather device. And Mr. R's target maximum expiratory pressure was about 25 centimeters H2O. Over the course of the summer, Mr. Roberts demonstrated improved tolerance to the resistance on the breather, which was noted by his increase in settings. His expiratory settings increased from 1 to 3 over the course of the summer. Mr. Roberts' gains using the breather reflected improved vocal performance and endurance, and they support the effectiveness of teletherapy for voice disordered patients. Thank you.